Great. Can everyone see that presentation okay?
Yes.
Excellent. So thank you for introducing me, Sonia, and thanks you to everyone for listening in today. This presentation was originally done by Dale Ischia, who is our manager and owner of our business Moving Beyond Cancer, of which I work, and Melbourne Exercise Physiology Group. And this presentation was originally presented from Dale, and I've added a few tweaks in it as well. So the aim for today, as Dale would say, if I can encourage at least one of you to start exercising, if you're not already, then I'll be very happy. So the presentation on exercise and upper GI cancers. So first I'm presenting to you a bit of a game changer in research, which was from, in 2019, the American College of Sports Medicine, the Roundtable Report, which essentially stated at the end of the report there that being physically active is one of the most important steps people of all ages and abilities can take for cancer prevention, treatment, and control. And the report showed that there was some strong evidence that exercise can lower the risk of 7 different types of cancers. It actually covered beneficial effects for 16 different cancers, but in terms of preventing, the research was strong for breast, colon, endometrial, kidney, bladder, esophageal, and stomach cancers. The research also demonstrated that it can improve survival post-diagnosis and help with treatment management. Unfortunately, in upper GI cancers, the research is limited, so it didn't actually demonstrate this for this particular cancer groups, and it was in breast, prostate, and colorectal, but it certainly shows good evidence and potential support for future research in this area. And as I said, a bit of a game changer in terms of looking at the benefits of exercise for as part of cancer treatment. So we have made significant progress in treating cancer, but now we're also looking at how exercise can manage the treatment side effects and focusing more on the treatment side effects and how to deal with them. So thanks to modern medicine, nausea is no longer a common side effect, but fatigue is. And other things that people often experience are cramping, peripheral neuropathy, depending on the types of chemotherapies you might undergo, diabetes, whether it's a worsening of the condition or a diagnosis of diabetes, a weakening of your core structure, particularly after surgeries, and potential heart problems. Cardiotoxicity is key for monitoring and watching for symptoms of cardiomyopathies, for things like shortness of breath or ankle swelling, swelling in the face or arms. These are about sort of managing your symptoms or better understanding what to look for, and can also change exercise prescription pending any issues that arise. And then deconditioning of your cardiovascular system, your muscular system, and our neurological system. And of course, increasing the risk of infection with weakening the immune system. So reducing your red blood cell count and your hemoglobin, as well as your neutrophils, which are part of your immune systems. So monitoring for signs and symptoms. But these are the sorts of things that we monitor exercise physiologists specialising in this area. And these are the sorts of things that we now look to manage better through people's cancer journey. So not only cancer diagnosis, but once starting treatment, this creates the perfect storm of deconditioning. So depending on age and previous previous health conditions, on top of that, drug toxicities, and then requiring bed rest, maybe after surgeries or with severe symptoms of post-your treatments, lack of physical activity, previous chemotherapy treatments, maybe prior to surgeries, immunosuppressive therapies, and as I said, the normal aging process. They liken 12 weeks of chemotherapy to similar of 10 years of aging on the cardiovascular system. And 40% of cancer patients are insufficiently active based on research, and 33% are completely inactive. So again, creating this perfect storm of deconditioning. This can be on the cardiovascular system, our respiratory system, our musculoskeletal system, and our neurological system. The good thing is exercise prevents and reverses the deconditioning process. And the sooner we begin exercise, the less conditioning can occur. So this was some research, more recent research in esophageal cancer that showed, so it was 2022, and it was a small cohort study. So it's important to note with research, and as I mentioned before, there are limitations in this area of cancer research, but we are developing gradually over time more and more understanding. But this research in particular is significant as it had a control study of people who exercised and people that didn't during chemotherapies. And what the research findings show that exercise for esophageal cancer patients undergoing chemotherapy may enhance the tumour regression and downstaging. And the table that's on the right there, the CD 3, 4, and 8, they're all markers of our immune response. So the darker panels were those that did the exercise intervention, so they had a better immune response. And then the other markers there are inflammatory responses, and inflammation is actually a precursor, a catalyst to some cancer progressions. So again, we showed this research showed that there was an improvement in our immune system and a reduction in our inflammatory markers. And the research also showed that exercise during chemotherapy can improve body composition, and they showed this by an improvement in markers of sarcopenia. So that's muscle mass and strength. And often this happens with age as well. We lose muscle mass and strength. So exercise had shown when people went on chemotherapy, they had a reverse of that loss of muscle mass and strength, which happened in the group that didn't exercise. Again, a small research study, but certainly positive results, and goes to show the importance of further research in this area to look at the impacts of exercise during treatment, and also the long-term impacts of exercise to manage our treatment side effects, and then also manage our long-term health. So again, counteracting the deconditioning with reconditioning, exercise should be a part of everybody's cancer treatment. Exercise versus movement, is there a difference? Fundamentally, no. Every movement that we do creates greater lymphatic flow, encourages blood circulation, and all exercise incorporates movement. So you can see a few examples of different exercise there. I think people sometimes are concerned with the expectation or the idea of what exercise means, and whether it means running on a treadmill and working really hard or lifting heavy weights. Tai Chi, yoga, all these forms of movement are also forms of exercise, and essentially some is better than none, and more is better than some with the right dose. So movement is a part of exercise, and every time we move, we encourage muscle activation, which is a part of maintaining our condition. If I could get some of you, if you're feeling comfortable at the moment, just to give me a few shoulder rolls while you're sitting there in the chair. So you can roll your shoulders back gently. Some of you might feel it's a bit crunchy, but as long as the movement doesn't create pain, it's a very simple exercise. And often when lots of things that we do during the day bring us forward. So we drive and lift and carry things, but there's not much that we do to encourage open chest position and open shoulder position. So that rolling of the shoulders back, it encourages blood flow to our shoulder joints. And that's an exercise in itself. So something quite simple. Something else that's quite simple is a seated knee extension. So I'm going to pop back a little bit from my chair here so you might be able to see me a little bit better. But essentially, even while sitting in your chair there, extending your leg engaging our quad muscle and then slowly back down. If you feel comfortable to join me with this one, have a go. Quite simple exercise. It, again, encourages quad activation. So that's part of strength, and the weight of lifting our leg counts as resistance exercise. Excellent. Good. I'm coming back to the screen now. The other one we can also encourage is finger movement and open extension of hands. So again, these type movements are simple, but they are part of exercise. It's not all about running on a treadmill, sweating hard, or lifting heavy weights, and it's about appropriately prescribing to you and what your concerns are. Exercise is like medicine, it has a dose response. An exercise physiologist can prescribe exercise that's specific and targeted to you. We also interchange the word with physical activity. As you can see, people dancing in the screen there. And it's got to be specific to you and your needs. And I'll talk a little bit further about how you would incorporate that to begin with, if not already. Coming back to some of the main concerns in terms of treatment side effects. So fatigue is one of the most limiting factors on quality of life, and it's quite common across many cancer diagnoses. So 40 to 80% of people undergoing active treatment, and it's characterized by weakness, heaviness, poor concentration, low motivation, trouble sleeping, and difficulty completing daily tasks. There's as much physical fatigue as mental fatigue. So again, hence the poor concentration. It can depend on the types of treatments that you're undergoing, but everyone experiences it slightly differently. And exercise is the best management. For some people, the usually diminishes over a year post-treatment. And in 20 to 30% of cancer patients, their fatigue can last for up to 5 years or more. So it's certainly something that we look to best manage and target specifically to each individual client. And as I mentioned before, exercise is actually part of the most effective management from what they've shown in research to date. So there's a contributing factors and a storm of fatigue. So the cancer diagnosis itself, hypothyroidism, an underactive thyroid is common post-radiation treatment to the lymph nodes in your neck. Cancer treatments like chemotherapy can have varying effects on fatigue for some people experiencing in a few days post-treatment or accumulative over the period of their treatment. Chemotherapies can also play havoc with your cortisol levels and your circadian rhythm. So naturally, when our cortisol levels should be low and and restful towards the end of the night so we can sleep well, chemotherapies can actually manipulate that and change that a little bit so that we feel more awake at night and more sleepy during the day. Radiation can have an accumulative effect and usually lasts 3 to 4 weeks post-treatment when it peaks. Hormone treatments can cause fatigue while treatment continues. Fatigue can last for up to a year for those that have had bone marrow transplants. And medication like antihistamines, antidepressants, narcotics, and anti-nausea drugs can all have a fatiguing effect. Depression and feeling of helplessness. It is common to confuse fatigue and depression and not to know which one came first. But again, the good news is that deconditioning for depression, pain, inflammation, anxiety, sleep disturbances can all be helped with exercise, and those why I've highlighted those ones in yellow in the bubbles there. And we need to break the fatigue cycle. Again, it's this perfect storm of we feel fatigued, so we rest, and in that resting period we decondition a little bit further, and then we get less fit, it's harder to move, we become less active, and hence it worsens our fatigue. So it does sound counterintuitive to exercise when you're fatigued, but at the right levels, it absolutely can help improve your vitality help slow or stop the deconditioning process. Exercise can also improve immune function, but the dose is really important. The chronic effects of exercise and consistency with exercise can improve our immune competency. So our immune function essentially can improve with regular, consistent exercise over time. But it's also important to note that acute, intense, prolonged bouts of exercise can temporarily decrease our immune function. So it's important as to how hard we work, and to note when it's appropriate to work a little bit harder, and what dose is appropriate for you at what stages of your treatment, and basing it on your symptoms and side effects. As I mentioned before, just moving helps the lymphatic flow, so it helps improve our immune system flow, but it has to be at the right times, and listening to our bodies, as I'll talk a little bit I'll talk further to in the presentation. This is a flyer that we have at our practice that Dale produced, and it's something that we often give out to patients to just show the exercise, what exercise can do during cancer treatment. So it not only helps with the cancer treatment side effects, but it also improves your immune function, as I've mentioned, the efficacy of your treatment and your tolerance to treatment, improving your bone density and body composition, improving your pelvic floor function, which is often reduced during chemotherapy or radio treatment to the pelvic area, improves your mood and sense of control, improves your quality of life, and can improve your sleep as well. So many benefits. As I mentioned before, exercise is part of best medicine, but there is a dose response. And like the American College of Sports Medicine, the Clinical Oncology Society of Australia has also now recommended that exercise be a part of standard cancer treatment and care. It's been shown that exercise training is safe and feasible across the cancer continuum, and that essentially means from pre-diagnosis, during treatment, to post-treatment, and even palliative care. And exercise should be a part of everyone's cancer care. And it's a specific dosage needing to be prescribed. So what you can see on the two bottles there, aerobic exercise. So this is like walking or cycling, swimming. And that's to be taken as a minimum of 30 minutes a day, 5 days per week. And the resistance exercise, so things like weight, lifting resistance, even body weight is a resistance, and that's to be taken for a minimum of 30 minutes, 2 days a week. But yes, this is very generic prescription, and this is for the general population. So this is not specific to everybody's individual needs, which is why an exercise physiologist is important, all this establishing baseline and monitoring throughout your cancer care. So there's many considerations for upper GI cancers. And so the dose is about the mode, which is, again, aerobic or resistance, balance, flexibility. These are the types of exercise. And then it's basing that off the intensity, so how hard to work, how often, and then the duration. And this is part of the dose of exercise, like medication. The Borg scale is something that we often use with clients in the clinic to, again, assess their level of perceived exertion and to help you rate and understand how hard you should be working and when to apply harder and lighter bouts of exercise. So hopefully most of you are feeling at the moment somewhere between that 6 and 9 while you're sitting listening to me here. And sometimes it's appropriate to be working between that 10 to 12. Often when we talk about moderate intensity exercise, we're working between that 12 to 14 level, so somewhat hard, and it can be likened to things like light resistance training and cycling. And then we get into the harder or vigorous categories of exercise, which are 15 to 18, like running or heavy resistance training. So again, there are many different intensities of which exercise can be prescribed at different times during your treatment and even during a session. And it's based on your symptoms and your side effects in terms of what's appropriate. As mentioned before, exercise must be tailored. So considering your individual circumstances of how recent was your surgery, are you undergoing chemotherapy or about to commence chemotherapy, joint problems that we need to be mindful of, and how your treatment has affected you. So once starting treatment, PN stands for peripheral neuropathy, fatigue levels, your balance, anemia, so your blood levels, your neutropenia or pain. So watching for heart symptoms by monitoring your blood pressure and your heart rate response to exercise, looking for any signs or symptoms of cardiac and lighter intensities or any swelling in the feet or hands. Looking for joint pain, common side effects of some chemotherapy technique when we're doing resistance training is important. Increasing the risk of infection with low immunity, so we should be avoiding public swimming pool, undergoing treatment and not comfortable leaving the home or being in a group setting. So it's a bit of a silver lining of COVID that's fast-tracked the option to offer telehealth to people. So we are still offering that to a lot of clients. And during your radio treatment, avoiding chlorine for potential skin irritations. Surgical scarring and radiation can limit our range of movement. So being cautious to gradually improve that and how much to push and being gentle with it and gradually improving our movement as we can is important. Peripheral neuropathy, which can affect our balance and also result in blisters. So making sure that we've got appropriate clothing and supportive clothing like shoes and proper socks, but also monitoring those symptoms to avoid maybe impact exercise if experiencing things like blisters or pain. Low hemoglobin levels and immune suppressive or fevers, you should be avoiding exercise or high intensity exercise. And if experiencing reflux, face down positions and forward trunk movements might be something that you also need to avoid to improve your symptom management. And when nauseated or high levels of fatigue and muscle weakness, exercise to toleration. It's important to factor in goals and what you enjoy. Part of our job is prescribing exercise, but we've also got to make sure that you see purpose and benefit in it, but also that you can see the reasons and have an enjoyment aspect to it to maintain your adherence. So it's important for personal preference and maybe things that you've experienced in the past that you'd like to reintroduce or learning something new and different that maybe you haven't incorporated before. Previous fitness levels and current fitness levels are important, so establishing baseline with individuals. And making sure that we incorporate all aspects of our health and function, so cardiorespiratory or cardiovascular exercise, strength conditioning, core and abdominal exercise, balance and flexibility. Before starting an exercise program, it's important to make sure that you've got the right nutrition to fuel for exercise. Are you absorbing enough nutrition to fuel your exercise program? Do you need enough fats and carbohydrates, protein and vitamins and minerals? And checking that your blood levels are within a safe range. If your blood cells are low and it can cause increased fatigue, and it should only exercise at very low tolerance. If your neutrophils are low, resulting in suppressed immune system, you should be avoiding exercise in public spaces, as I mentioned before. And if your platelets are low, you should be avoiding impact exercise. So again, comes down to the specificity of what you're experiencing and what exercise is appropriate for you. Loss in muscle mass and strength. It's important to go easily and slowly build your exercise tolerance. So if you've lost fitness and strength, you need to first establish a baseline, and that's where an exercise physiologist can test and assess this with you first, to then know what's appropriate to start and how to slowly build your strength back. Is your diabetes well managed? Exercise can certainly fluctuate our blood glucose control, so that's also important to make sure that we're managing that well. Cramping, it may be a sign of something else is wrong and that we should be checking with your doctor, but it can be commonly best managed with good hydration, drinking 1.5 to 2.5 litres a day, stretching the affected area, and good nutrition to make sure you've got the correct sodium, potassium, calcium, and magnesium for smooth muscle function. A healthy diet can provide all of these nutrients, but it requires, and so supplements may not be required, but that's also something that we readily do in terms of referral on to nutritionists if that's something that we feel is lacking. And we've got a group of ladies from Encore that some of you may already be aware of or may have spoken to, and they're fantastic in their expertise in terms of oncology and nutrition and dietetics. If you have a port in, is it okay to exercise, and making sure that one, it's well healed and established, and then it's protected during exercise. Once this has happened, there's not much limitation to what you can do, but making sure that we are protecting the area and keeping it covered while exercising, and making sure that within the first couple of weeks that it's been inserted, that we're avoiding too much strenuous exercise over that area. Ensuring recovery from surgery. Surgeons often give you some guidance in terms of what you're restricted to do within the first couple of weeks, but that's also something that we have knowledge in terms of what can be done and what should be avoided over the course of that time. Exercising post-surgery, as I mentioned before, it's important to exercise early. Movement like ankle pumps can prevent blood clotting. Short walks every 2 hours, example, as short as getting up and going to the toilet, so regular movement. 2 kilo limit restrictions, depending on the surgery that you've had and your surgical restrictions, but this is often a common win within the first 6 weeks post-surgery, that 2 kilos is the limit. And to give you a reference point there, a 2 litre bottle of milk is 2 kilos. Breathing throughout your exercise, understanding good control with breath control, and making sure that we're avoiding breath holding is also really important. And then focusing on legs and gradually building abdominal strength over time once our restrictions of lifting have. So if I could get a couple of you now just to do a few ankle pumps for me if you're comfortable while sitting there. So just as simple as flexion extension of the ankles. Again, when we've been sitting for a little while, this also encourages blood flow back up to the heart, encourages any fluid retention in our ankles, which can happen towards the end of the day, and it starts to wake up the body after we've been sitting for a little while. Gradually increasing your load over the course of your treatment and post-surgical restrictions. Again, the guidance from an exercise physiologist to work through that based on your baseline assessment, and then slowly building up over time. Exercising during chemotherapy. It is safe. It's recommended to keep active to prevent the deconditioning process and maintain our blood flow and lymphatic flow. But exercise is tolerated, and often we modify exercise according to our treatment responses, and the cycles that people experience means that we can also change the cycle of exercise in terms of volume and intensity throughout the treatment cycle, making sure that when fatigue is high and symptoms are high, that we're exercising at a lower volume and intensity. And then as we start to feel improvements, we can build our exercise intensity and frequency back up. And expected fluctuations through your treatment cycle. Some people, again, first couple of days post-treatment may feel relatively okay, but it's important to not over-exercise in that period, because often for those with chemotherapy, you can have a course of steroids, which helps with nausea and helps with appetite, but it also gives you a false sense of how much exercise and how well. And then it's often the 48 to 72 hours when people start to feel more of the effects of fatigue and their symptoms come about. So it's important to listen to the body and pay attention to our symptoms, but also to understand the volumes of exercise to expect as we go through our treatment cycles, and the same with recovery from surgery or any other treatments. So being guided by your own perception, and that scale that I was using before, or a scale of 0 to 10, is something that we often use in the clinic to give you an idea of how hard you can work at a particular time. And watching out for balance issues, and as I mentioned before, the port and the PICC line, being mindful of that in the first couple of weeks from insertion, and then after that, just making sure that it's protected when we're doing any upper body exercise. Talking about fluctuation in energy levels, exercise tolerance will vary from day to day. And it's about pacing yourself and understanding your good days and your bad days, and your no-way day exercises. And when I say no-way day exercises, it's the days where we might be a little bit more restful. We're still encouraging movement, blood flow, lymphatic flow, but it might be more seated and lying exercises. And again, we're encouraging movement at all points throughout the treatment cycle, but different volumes and intensities to appropriate dose. As I mentioned before, something is better than nothing. But rest and recovery is also important, and it's important to find that that appropriate time to rest and recover, and introduce exercise in short bouts on our high fatigue days or high symptom days. So how to begin as soon as possible. Supervised graded exercise from an exercise physiologist or similar professional, and starting low and progressing slow. So an example of changing our duration of exercise, it might be as simple as starting with 5 minutes of walking every second day at a comfortable speed, and increasing this by 20% every 2 to 3 weeks till you reach up to 30 minutes of continuous exercise. Another example of increasing frequency might be that 5 minutes of walking every other day increases by 20% every 2 to 3 weeks until we're walking up to 30 minutes every day. And it's not about increasing duration and frequency all at the same time, but these are the different aspects of exercise which need to be considered. And then increasing intensity would be to gradually introduce an increase in your speed, or start to incorporate hills or stairs to make the effort slightly harder as you're able to do so. So fatigue management tools, this is really key. As I said, most of you will experience or are already experiencing high levels of fatigue. So relaxation and meditation can help manage these in our restful periods where our fatigue levels are high. Establishing realistic goals, as I mentioned before, listening to the body and understanding when your symptoms fluctuate, when they're typically high and when they're typically low. So you can pace yourself throughout the day and the week. Exercise at a time that is least fatiguing. For some of you, that might be in the morning, but it also might be more suitable for you middle of the day or end of the day, depending on what else you've got on within your lives. And consistency to be sustainable. Our body likes regular routine with movement, so trying to be consistent with that, but mindful of when we require more rest than other days. Eliminating activities that are causing you to crash. So again, noting high intensity exercise or high intensity activities that really result in a high level of fatigue that require more rest after. It's important to avoid that peak in exercise or activity, and then longer periods of rest. We want to try and find a fine balance of exercise that adds to our day and not takes away from it. So we can exercise and get on with the rest of our day without requiring too much more rest than usually needed. A use of a diary to record your exercise and noting your fatigue response and your energy levels and your mood and other activities. That helps people establish, why they feel their symptoms are worse or higher based on maybe the other activities they've done for the day. Social events and lots of medical appointments can also result in a lot of mental fatigue or psychological fatigue. So it's also important to note with our concentration levels when we also need to rest, because trying to incorporate new exercise or new things when we're also already highly fatigued from what else we've had on for the day may be too difficult or unrealistic. Distraction with movement and laughter, exercising with friends and family is key, but listening to our bodies at the same time, and eating nutritious foods and having a good stable blood sugar and weight is important. And regular sleep habits, as difficult as that can be with certain treatments affecting when we feel awake and when we feel tired, but trying to stick with a regular routine and finding maybe the more quieter restorative things to do, like relaxation and meditation towards the end of the day. Avoiding screen or caffeine before bedtime is key. Speaking before about how to self-rate our energy levels and scales that we often use with clients throughout their fluctuations in fatigue, we use a scale here, the Likert scale from 0 to 10. So 0 to 3 is when we might feel like our fatigue is well managed and under control. And 4 to 6, with that, we would expect to reduce our volume of exercise by 50%. And if we're feeling a 7 to 10, then it's a restful day, potentially a no-way day. Exercise is why we might do a bit more movements in seated or lying. So that's a helpful scale, and it is subjective, but it's true to how you feel, and it's listening more attentively to how you feel and the expectation of what you can manage for the day and exercise in particular. When to stop exercising. So feeling dizziness or fainting while exercising certainly should be stopping. Signs of heart problems, so shortness of breath at rest or small amounts of exertion that's unusual. Chest pain or irregular heart rates or palpitations. Unusual swelling in the ankles, face, neck or arms. Low blood counts. If you have a fever or high temperature. You have an active infection and severe diarrhea or vomiting. These are all indications that these are all symptoms that exercise should be avoided. I'm going to do a quick test for those that are willing to participate or feel able to participate. So this is a 30-second sit to stand, and it looks at our leg endurance. So what I'm going to do, for those who would like to participate, is give yourself a bit of a room from the computer, sitting on your chair towards the edge of your chair. Feet flat on the ground and knees in line with our feet and shoulder or hip width apart. If we can, without our hands, we're going to stand up from the chair and then slowly sit back down. That's the first one, just to get our balance right. I'm now going to time you for 30 seconds, and I'd like you to count as many as you can do in the 30 seconds. So I'll give you one more chance to have a practice stand. So up from the chair and back down. You're going to pace yourselves. I'm going to time now for 30 seconds. I'll tell you start and stop, and I want you to count how many you can do. Ready and go. and stop. Well done. Excellent. Hopefully that wasn't too challenging, but it's essentially a test that we often do in the clinic, which looks at our leg endurance. And if you remember the number that you achieved, then you can look at your age category comparison. So there's one between 60 and 64 years of age and along the category there to see how close you were to getting what is an expected average of sit to or standing up and sitting back down over the course of 30 seconds. So if you didn't get close to that number, that might be a sign that our leg endurance is maybe something that we need to improve, and that's our muscular endurance. The other test there is a stalk stand. So it's a single leg balance. Again, with this one, the aim is to hold for as long as possible without tapping down. So if, again, you feel comfortable, we're going to stand up from the chair and you need to give yourself a little bit of room and space. When doing this one, it's important to have something close by so that you've got a balance support if you need. But essentially what we're doing is standing on one leg. The idea is to not hold on to anything and to not allow the leg that's lifted to touch anything as we go. So you might be able to give this a go. Now I'm going to hold for about 30 seconds here, see if I can hold. So have a go if you're willing to have it. And I'm about 10 seconds in, and the idea is to stay as still as possible. That's about 20 seconds gone. 25, 30, 35, 40, 45, and I'm going to stop timing at 50 there. Well done. Excellent. So again, with the stalk stand test there, or the single leg balance, when we look at what we aim to achieve, and again, this can be very difficult if experiencing symptoms of peripheral neuropathy or our sensory input is dampened. But over 50 seconds is excellent. Between 40 and 50 seconds is good, and an average of 25 to 39 seconds. So when considering to see an exercise physiologist, what type of movements do you enjoy? That's a question you should ask yourselves. What are your barriers to exercise? And this can be something like the lifestyle that you live and people that you might be caring for or work. What would you hope to achieve by increasing your daily activity or exercise? And what do you have access to? Exercise physiologists can come under the Medicare rebated care plan, which gives you eligible up to 5 sessions over a 12-month period, and every year you can gain another 5 sessions. And it's a rebated session, so they get some return from Medicare, and you would all be eligible with a cancer diagnosis to access that. There's also a diabetes specific management plan, which allows you up to 8 sessions with a group setting. And that incorporates an assessment as well. Private health insurance, depending on your level of cover and what you are, you can claim under private health if you've got cover. And you can find an exercise physiologist that's close to you through exercisesportscienceaustralia.org.au. So those details there, and basically you put in your postcode and they'll tell you where an exercise physiologist is located to you. That's the practice that we work out in Camberwell, as you can see on the screen there. So everyone should be exercising, and it does help to live longer and stronger. Exercise is something that you can do for yourself and can be where you gain control of your body. It has physical benefits, psychological benefits, and benefits for those you care about. Exercise should be a part of your medical care, and at the right dose, there is no adverse side effects. Thank you very much for joining me today, and I'll hand it back to you, Sonia.